Hello, I'm Dr. YouTube. I regular upload educational medical videos. In today's episode, I'll be talking about the types of lung cancer. Lung cancer can be divided into small cell lung cancer and non-small cell lung cancer. Let's first talk about small cell lung cancer. It accounts for about 10% of lung cancers and is pretty much always only found in smokers. Here is a small cell lung cancer. They typically have a prominent nuclei, as you can see there and there, and very little cytoplasm. It's a highly malignant type of lung cancer, and unfortunately prognosis compared to non-small cell lung cancer is very, very poor. Treatment is chemotherapy because by the time a small cell lung cancer is diagnosed, usually it's pretty widespread with multiple metastases, widespread in the body. So really surgery is not really an option. Now how about 90% of the other cases? So 10% are small cell, 90% are non-small cell lung cancer. The different types of non-small cell lung cancer can be remembered as ASL, adenocarcinoma, which is the most common type of lung cancer in general. S is for squamous, and L is for large cell lung cancer. So lung adenocarcinoma, as I said, the most type of commonest type of lung cancer, the most common, also found in non-smokers, tends to be found quite peripherally and is not as responsive to chemotherapy. If found early, surgery is usually the option. So that is adenocarcinoma. How about squamous? Squamous is very closely related to smoking. It's often found centrally, so squamous, central. And it tends to be quite necrotic. So usually starts as a small nodule to begin with, then becomes necrotic, and so this is this is a squamous type of cancer. You've got your stratum corneum, epidermis, and dermis. So if you imagine, you have all this, stratum corneum buildup, and the inside becomes very, very necrotic. Now, squamous lung cancer is associated with a paraneoplastic phenomenon called secretes parathyroid hormone related peptide. And what that does is, although it's not a metastasis itself, it increases bone resorption, increases calcium reabsorption, and inhibits phosphate reabsorption. And therefore it increases calcium level. So yeah, this is PTH-rp, found not uncommon in squamous lung cancer. Now, the paraneoplastic phenomenon, as I said before, is not a metastasis itself, but it's basically as a result of cancer cells releasing cytokines. It can be found in small cell. In small cell, it causes SIADH, low sodium, and it can also cause Cushing's syndrome. So the three types of paraneoplastic phenomenon. So we talked about A, adenocarcinoma, S for squamous, and finally let's talk about large cell. Large cell lung cancer tends to be found centrally in the lungs, And under histology, it's salt and pepper chromatin, as you can see there. There's a lack of salt and pepper chromatin. Of the high cytoplasmic to nuclear size ratio. Anaplastic cells are predominant. So let's just quickly summarize types of lung cancer. Small cell 10%, non-small cell is 90%. Small cell lung cancer have a very large nuclear to cytoplasmic ratio, found almost only found in smokers. Very poor prognosis. Treatment's chemo, not surgery. Non-small cell, you have ASL, adenocarcinoma is most common, and is also found in non-smokers. Found peripherally, and you also have squamous cell lung cancer, which can cause central necrosis. Remember all that stratum corneum, and can cause PTH-rp, causing hypercalcaemia. You also have large cell carcinoma, which has a large cytoplasmic to nuclear ratio and is found more proximally. I hope you've enjoyed this video. If you do, please give it a thumbs up, like and subscribe. Look after your lungs and try not to smoke. Take care.